Hi everyone, so excited to be making a video after so long. Yeah, that's just me procrastinating, I'll be very honest. Um, and I have been very busy with uni, but also the cricket, I will admit the cricket is on, the Ashes. Um, I know a lot of you are American and probably don't quite understand the excitement, but the Ashes is Australia versus England playing cricket, and that's always it's a rivalry that's been going on for a long time, and we're doing pretty well. So yeah, it has taken my attention away, and actually have it muted in the background at the moment. So if I get excited, you'll understand. But I want to make a video right now because September is International Pain Awareness Month, and I thought that was really important. Yeah, to make a video in in celebration of that, but I guess in recognition of that, because that's something so many of us have to deal with on a daily basis, an hourly basis, a minute by minute, moment by moment basis. And I was coming back from actually the physio today, who's giving me some help with my shoulder. I've got bursitis in my shoulder, and that's going really well. And I heard about a book release. It's actually not released until November, but it's called Pain and Prejudice. And it's about, if you've actually are familiar with John Oliver and the uh, his show, what's it called? Uh, this Week Tonight? No. Oh my gosh. Oh, I've been watching it for years. Yeah, you can Google it. If you know John Oliver, you'll know what I mean. He did a segment on bias in medicine a month or so ago, and it was really interesting, talking about how many health practitioners, particularly medical practitioners, have an inherent bias that they may not even be aware of in the way that they deal with women and also minority groups. But for this video, I'll focus on women, particularly in the way they deal with women's pain, which leads to a delay in diagnosis and an underprescription of pain medication or pain therapy. And that's what this book, Pain and Prejudice, deals with. This woman has endometriosis, and it took her a ridiculous amount of time to get diagnosed. And I know that's the case, and she interviewed a number of women with various types of pain disorders and heard their stories, and they all had the same type of story. The doctors poo-pooed their pain, told them, it was in their head. And by that I don't mean it was neurological, that it was psychological, psychiatric, or that, they were making it up. They were just stressed. If they just did X, then they wouldn't have the pain. How many times have we heard that? I myself have heard those things. It took me 4 years to get a fibromyalgia diagnosis. I don't know how many doctors, specialists I went to. And even after I was diagnosed, I developed migraines, cluster headaches, and other medical complications, vertigo. I still have neurological symptoms I'm trying to get to the bottom of after, I've had fibromyalgia for 27 years and developed some neurological symptoms about 10 years ago. I'm still trying to get to the bottom of. But I've been told by doctors over the years it was stress. If I just rested more, if I didn't stress, if I exercised more, if I just did X, then I wouldn't have this pain. And all that does is put the blame back on, it's victim blaming, or puts the onus back on us. And in doing that, the doctor's not listening to what's actually going on. And there's a delay in diagnosis and therefore a delay in treatment. And that's not okay, because that's happening to women at a higher rate than it's happening to men. And women suffer from pain related illnesses that have an invisible component to them at a higher rate than men, such as fibromyalgia, obviously, things like endometriosis, but also inflammatory, God, my brain is just not working at the moment. Autoimmune diseases and other things, often at a higher rate than do men, and are treated differently by medical practitioners than are men, and they often present differently. But I was listening to a critique of John Oliver's show, the show titled Bias in Medicine, by a real-life doctor, and he did make a few interesting points that I think are worthy of consideration. And it's not to put the onus back on us, but it's to say, well, maybe there's some things we could do to facilitate the communication with our health professionals, many of which, unfortunately, are men. And his perspective was, well, part of the issue may be that the way, and this is a generalization, so take it that way, that many women, when they're describing their symptoms, do so in a descriptive manner. And yeah, I know I've done that in the past. When I think about it, I go, well, and also will tell me what's been happening. They might sort of use an open-ended question like that, or, tell me about it, describe what happened when you first experienced that. So we might describe what, or answer that question in a descriptive manner using a story. Well, I was here, I was doing this, then this happened. And it's easy, particularly if we have some cognitive issues, brain fog, inability to focus from the pain or from other symptoms, it can develop into a long, winding, almost rambling story. And I think the manner in which we communicate can almost be a barrier to communicating effectively with a health professional. And there's no right or wrong, but it's just thinking about, well, what is the most, if we want to get our point across, what's the most effective way to do it? So I think that's an interesting point. And he said that in contrast, many men tend to be more direct, focused, very to the point. And that seems to be something that a health practitioner can more easily, those messages are more easily, they have a better cut through, more easy to receive them, take them in, right, okay, got it. So I thought about that. Thought, okay, that kind of makes sense. Yeah, I get that. But then I thought about what happened to me only last month. I have what has been described by a neurologist as a migraine, and it doesn't seem to fit with a normal migraine. I have various triggers like noise, heat, light. It sets off a neurological cascade, muscle weakness, involuntary hand movement, slurred speech, and whatnot. And it lasts for about 10 or 15 minutes, and then I'm fine. But I can't grip anything. I do this. My feet turn inwards. I sound drunk. I have to carry a little card with me because it happened in Coles once, and they wanted to call an ambulance and called a code red. But because I couldn't speak properly, it's always the concern that I don't need an ambulance, so I don't need people to overreact. So I carry that card with me. Anyway, I'm trying to get to the bottom of what it is. So I saw another neurologist in Sydney for another opinion, and I wrote everything down. I wrote down the observed triggers that I've noticed over many years, and then exactly what happens, the types of symptoms I experience. Wrote it all down, also so I'd remember it, because I knew he'd ask. So he did ask, and I just read from that, so it was all bullet points, bum, 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 yep, and then this happens, and I could show him as well. So I thought that was really concise. I wasn't all rambly, kind of vague. And then he was doing a neurological exam where he shone a light in my eye, happened to trigger one of these. But then at the same time, so he started to trigger one of these, and then I started to feel it occurring. But then he went on to test my reflexes with a thumper thing on my knee, which hurt so much from a fibromyalgia point of view. So I was like using my hands to go, oh, please stop, and squinting my eyes. He instantly, and my partner was with me, so he could back me up. This doctor, neurologist, instantly labelled that. He said, oh, I know what's wrong. That's a panic attack. And I went and read the DSM-5 criteria for a panic attack. I get 0 symptoms. And I've discussed this with my rheumatologist. And she said, yeah, that really doesn't sound like a panic attack. Now, I'd given him all of my symptoms, all of the triggers. He did that little exam, and I was concise, He saw that one little thing, panic attack. So how are you supposed to take that? And he referred me to a psychiatrist. So, yeah. Interesting, right? Anyway, getting another referral, seeing another neurologist, but I am going to see the psychiatrist because there's a possibility that there is some, I don't think it's a panic attack, but there could be some psychological component or not that triggers it, but that could assist. Anyway, I'm keen to see what he says, to be honest with you, and I've hit my Medicare threshold, so it'll cost like $20. So, yeah, so that doesn't seem to gel with what that doctor had said. I kind of came in and gave him info like a guy, but I still got treated like a woman with a neurotic kind of, hysterical reaction, and I wasn't. I just wanted the pain to stop. So it makes you wonder, doesn't it? So I'd be interested to get some comments from anyone else's experiences, because I've certainly been treated extremely poorly, and I can tell you honestly, they've all been from men, and I've seen probably 30 or more specialists over my life, and probably a good 20% of them have been women, and none of them have been jerks. They've all been excellent. Only the men have been jerks and treated me like I was just an hysterical woman, banging it on or making it up. So it's an interesting thing, but it's just, from our point of view, what do we do about it, and how do we get heard? How do we get around that bias that probably, I'm sure, doesn't exist, or obviously doesn't exist with all medical practitioners, with all doctors, with all specialists, and all treating allied health professionals, because there are some great ones out there. But how do you know? And how do we make sure that we're not seen as just another hysterical woman with a woman's issue, or a bit of pain, or a bit of a headache, when it's actually a god awful migraine or a cluster headache, which I've had. In recognition of Pain Awareness Month, and all those women out there who've suffered for years and years and years and haven't been heard. I hear you, and we hear you. So, with that, I think it's back to the cricket.